Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about vaginal estrogen after menopause. So for vaginal dryness or vaginal atrophy after menopause, typically the average age for menopause is about 51 years old. And a year or two after that, when women go through menopause, especially if they're not on any hormone replacement therapy, they can start to experience some vaginal dryness. And if they're experiencing that with intercourse or maybe just with daily living, they may start noticing increasing urinary tract infections or discomfort, and often your physician will consider prescribing you vaginal estrogen. There are many different formulations and unfortunately there's a lot of variation on the coverage and reimbursement with insurances, which makes it a difficult topic for prescribers. There are many different brands. There's generic, there's estradiol, which a brand name was Estrace. There's Premarin vaginal cream. Pharmacies can compound it. There are vaginal tablets like Vagifem or Uvifem is a generic for that. This is not systemic, meaning oral or patch or the gel on your skin. This is just a much lower dose for vaginal. And really what often dictates what you get is your insurance coverage. Although if you get a fixed prescribed amount, you're usually getting a more consistent dose than if you get a compounded from a pharmacy, which can have more variation in the dose. But if that ends up being quite a bit cheaper, that might be the way to go. There are different recommendations amount. I recommend a very small amount. Just a pea-sized drop, just a small drop twice a week is all you need. A little in the vagina, a little on the outside. It gets to where it needs to go. That small amount is not enough to treat hot flashes, mood swings, osteoporosis, thinning of the hair. It doesn't treat any of those things. It just helps with the vaginal dryness. If you're only experiencing a little dryness with intercourse, you're encouraged to try vaginal lubricants first, and then you can avoid estrogens. But honestly, if you need them, that small amount is so small that it doesn't really have a dramatic risk. Now, of course, this is a public video. I don't know your particular risks. No one can ever say there's zero risks, but the risks are very, very low because the amount is very, very low. There's even a nice ACOG report that shows that women who have used vaginal estrogen who have had breast cancer, even estrogen receptor positive breast cancer, have not shown any increased risk of breast cancer or recurrence taking vaginal estrogen. Okay, so while I encourage you to discuss this with your physician, you can reassure that it is the risks, the listed risks of stroke, heart attack, blood clots, breast cancer, all of those are extremely low, but especially low with a small amount. So we even give it to patients who've had those higher risk factors like breast cancer who cannot get the full dose systemically. Okay. An important thing to remember is what is it doing? It's not a lubricant. If you look at the vaginal tissues of a woman in menopause, after years especially, the tissue gets very thin. So what do I mean by that? Well, when you see a 90-year-old walking around, you notice they always have cuts and bruises on their arms. Why? Well, because their skin is so thin, you can almost see through it, and just bumping it can cause a cut or bruise. Well, the vaginal tissue does the same thing, but much younger. It's not fair, but that's just how the body works. So if this is the normal thickness of vaginal tissue, once you go through menopause, it gets super thin like this. And taking that tiny amount of vaginal estrogen is enough to restore that thickness back, to restore your own natural lubrication, and to allow you to maintain your sexual function, to reduce your urinary infections and help with the discomfort. I do have lots of patients who start this medicine and say that it burns. Well, if it burns, Some of the creams have a little alcohol in them, and it's usually an indication that you have an infection because it should not burn. So if it does, stop your treatment, talk to your doctor. You might have what's called atrophic vaginitis, or you might have a yeast infection. You might need an infection that needs cleared. I encourage you to get examined and tested to find out what it is, get that treated, and then after that's done, then you take the vaginal estrogen. There are other indications to have this medicine, vaginal estrogen, for example, in conjunction with other treatments. If you have a condition called lichen sclerosis, it might be recommended to you. But again, those are circumstances where you should speak with your physician to get clarity. I hope this has been some useful general information for you, give you some reassurance, and remind you of the small amount that you need to take only twice a week and how safe that small amount is. Don't take a much higher amount unless your physician specifically recommends it. But this should serve as a clarifying bit of information in case you had some questions. If you have any comments, I'd appreciate it. Thank you.